During this webinar, you will be hearing from Dr. Christine Gerard, Executive Vice President of Clinical and Academic Affairs, as well as Dr. Jeffrey Langland, Co-Chair of SCNM's Research Department here at SCNM. Once again, I'd like to thank you for attending our webinar. We hope you find this presentation both interesting and informative. And with that, let me introduce and give you a brief bio on my first presenter, Dr. Christine Gerard. Dr. Gerard completed her undergraduate degree at Goddard College in Plainfield, Vermont, and received her doctorate of naturopathic medicine from the National College of Naturopathic Medicine in Portland, Oregon. She participated in and completed the first hospital-based residency for naturopathic physicians at Griffin Hospital in Derby, Connecticut. Dr. Gerard's career has focused on hospital-based integrative medicine and leadership in undergraduate and postgraduate naturopathic medical education. So at this time, I'd like to turn this over to Dr. Gerard.
Thank you, Jody, for that very kind introduction. And good morning, everyone. I thought I would start by giving you what I'll call a bird's eye view of naturopathic research. And let's start with a fundamental question, or actually before I do that, let's start with learning objectives. At the end of our presentation today, you will be able to cite at least one reason research of naturopathic medicine is important, cite at least one group that benefits from the research of naturopathic medicine, be able to describe the progression of research for both complementary and alternative medicine and conventional medicine, and describe available research awards from the National Center for Complementary and Alternative Medicine, or NCAM, and describe some research opportunities in research, or career opportunities in research. So one of those fundamental questions, why is naturopathic research important? Well, in general, we think about research as expanding knowledge and evidence, and this is particularly important in medicine as we seek to provide patients safe, effective, and cost-effective care. Research often translates into improved clinical care, and for students, graduates, and physicians, it's very important in developing analytical and critical thinking skills, which again better serve our patients. So who benefits from naturopathic research? Well, a wide variety of people do. Certainly the public does, as through research we often preserve and protect the public health. Patients do, as we typically improve patient care. Students, as I've mentioned, gain the benefit of training in analytical and critical thinking. Physicians offers them a way of decision-making in regard to patient treatments. Often we end up with so many options with which we can treat a patient, we need to go through a decision-making process, and research helps us do that. And our medical community overall benefits from research as we add to the overall knowledge of medicine along with treatment options, as well as interactions between various treatments, herbs, and nutrients. We have what I call the progression of research. This ends up being an important component of things as we think about research and how it is conducted. Starting at the left, if we look at conventional medicine, we find that conventional medicine brings to market, treatments in the following way. Typically starting with laboratory studies, animal studies, moving on to human studies, and then ultimately in the public with consumers utilizing the treatments. On the right, we see that CAM, or Complementary and Alternative Medicine research, unfolds in exactly the opposite way. Often patients are already utilizing something that's considered complementary or alternative, and they're using these things before robust research has been done. We often find that those things that are most popular are elevated in the priority list of research funders so that we can do the safety and efficacy research on things because we have so many people in the public utilizing the research. And so why are patients seeking alternatives? Well, they do so because standard treatments don't work, or there are adverse effects of the standard treatment. Sometimes there's a stigma associated with utilizing a prescription medicine. Often there are systems that comprise complementary and alternative medicine, which often emphasize whole person care, communication and relationship with the physician-patient interaction, and also physicians exploring the patient's experience with their disease. Often these are not found in conventional care, unfortunately. Back in the 1990s, David Eisenberg from Harvard conducted a study of patients and found that the number of patient visits complementary and alternative medicine practitioners outnumbered the visits to conventional practitioners. You can see on the bar graph in front of you that in 1990, 427 million patient visits were to practitioners of alternative therapies, while in that same time, only 388 million were had to primary care physicians. Eisenberg repeated the study in 1998 and found the same trend. As you can see, the red bar, 629 million visits to practitioners of alternative medicine and 386 million to primary care physicians. What was significant here is that while the number of visits to primary care physicians stayed relatively the same, the number of visits to alternative practitioners jumped quite dramatically. It's also of note that of those surveyed, over a third were using alternative treatments in 1993, and then in 1998, that number increased to nearly half of the patients surveyed were utilizing alternative medicines. This is a bar graph that is on the NCAM website, and it basically shows us the CAM use of U.S. adults as well as children. The use of CAM in adults was measured by NCAM in 2002 and also in 2007. As you can see, 36% of adults surveyed in 2002 were utilizing CAM, those in 38.3% in 2007. In 2007 was the first time that the NCAM surveyed the use of CAM in children. The diseases and conditions for which CAM is most utilized for children, as you can see here, back and neck pain, head, chest, or head colds or chest colds, anxiety, musculoskeletal type issues, ADHD, and insomnia. In adults in 2002, again, we see a similar trend with the majority of reasons to see someone or utilize CAM is for pain syndromes, back pain, neck pain, joint pain, arthritis, that type of thing, along with headaches. And then also head or chest colds, anxiety and depression. In 2007, this has changed a little bit. You still see the pain coming up right at the top here, but one of the things that's dropped dramatically is the head or chest colds. This is an example, a very direct example of research being done in that 5-year time period, which demonstrated to us certain CAM therapies that had been used for head and chest colds found to be not effective, that were no longer utilized. And so this usage of CAM dropped dramatically. So the integrative medicine is growing. It's growing, excuse me, because we have research dollars allocated. We have research dollars allocated to integrative medicine and complementary and alternative medicine, along with increased use in hospitals, increased reimbursement rates, and we also have a number of academic health centers in conventional care belonging to the consortium of integrative medicine, and the Institute of Medicine in Washington, D.C. hosted a summit in 2009. We find that hospitals, 30% of them are utilizing CAM. These are the types of CAM therapeutics that are utilized. Many of these have research behind them. And we do have research challenges associated with complementary and alternative medicine. What we find is that it's easy to design a CAM study using allopathic paradigm and methodology framework that will have negative results. It's much harder to do a well-designed study. Some of the challenges that we have are that many complementary and alternative medicine type therapies are based on individual recommendations. There is a whole practice versus a single agent issue where that most CAM therapies are not given in isolation. There are typically protocol treatments versus a individualized treatment, so a condition intervention pair as an example. In addition, there are issues related to the types of therapies that we might use. So for instance, in an herbal study, the part of the plant that is used in the method of extraction is very important in regard to detail that often is not found in the typical pharmaceutical trial. In traditional Chinese medicine, if we think about the acupuncture that is often used, how do we create sham for acupuncture? Or how do we create a placebo for Reiki therapy? So these are some issues that we have in regard to research of complementary and alternative medicine. And so I'll turn our discussion to the National Center for Complementary and Alternative Medicine, as this organization has really helped us deal with some of these challenges within research of complementary and alternative medicine. The NCAM was created way back in 1991 as the Office of Alternative Medicine. The funding that was associated with it at that time was $2 million. In 1993, the Office of Alternative Medicine was moved, if you will, or established within the office of the Director of NIH, or the National Institutes of Health. In 1997, they conducted their first phase 3 trial in St. John's wort for depression. And then in 1998, the NCAM, as we know it today, was established by a congressional mandate. At that time, it became the 25th independent component of the National Institutes of Health. There are currently 27 independent components. This is a graph of the history of federal funding of NCAM. Going back to 1992, when it was the Office of Alternative Medicine and funded with $2 million, if you notice, we have quite a jump right here in 1999, and that's when the NCAM was funded for $50 million. And you can see that funding has increased over time. This is very good news for us in that this shows us how this one center that is truly focused on complementary and alternative medicine has been funded, and how the government and the NIH take research of our medicines very, very seriously. If we now look at CAM funding by the NIH, by institute or by center, and remember there are 27 institutes, I've only taken half a dozen of them just to show you that we have funding throughout the NIH. It's not only at the national, at the NCAM. This is the orange bar, the National Center for Complementary and Alternative Medicine. And this bar represents the previous graph that you saw. But in addition, if you look at this blue bar, this is the National Cancer Institute. Look at the number of millions of dollars of funding year over year that the NCI is committing to studying complementary and alternative medicine. And then down here we have a cluster of a number of institutes or centers that are funding complementary and alternative medicine somewhere between the $2 and $10 million range in each of those institutes. NCAM has 5 domains of complementary and alternative medicine. It's within these umbrellas, or under these umbrellas, that all research takes place. The research is essentially divided by domain in the biologically based systems, which would include herbal medicine, diet and lifestyle changes, manipulative and body-based therapies such as massage and chiropractic, mind-body, energy therapies that would include Qigong and Reiki, and then alternative medical systems, which would include naturopathic medicine, traditional Chinese medicine, etc. I wanted to share with you the NCAM strategic plan. It's their 3rd strategic plan in their in their history, and it spans from 2011 through 2015. I want to show this to you because I'm really wanting to demonstrate to you that there is a lot of interest in the study of complementary and alternative medicine. If you think about the therapeutic modalities that naturopathic medicine utilizes, mind-body medicine and natural products are two things that we use quite a bit. These are the first two objectives of the NCAM's third strategic plan, is to advance research in these two areas. The third objective is to increase the understanding of real-world patterns and outcomes of CAM use. And so this is that whole practice research that I mentioned earlier that's difficult to study and creates some challenges in regard to design. It's completely doable, but it just takes a little bit more. Also, this is very important for those of you who are still on the line. The fourth objective is to improve the capacity of the field to carry out rigorous research. What they mean here is to increase the number of CAM practitioners who are able to carry out rigorous research in their area and in other areas. And then they're also wanting to develop and disseminate evidence-based information on CAM interventions. So again, important stuff for those of you interested in research and wanting to be able to pursue a career in research and gain research training. So research training and career development opportunities through the NCAM are basically divided into two areas. Those who are expert in CAM clinical practice and those who are biomedical and behavioral research scientists. Pretty much those of us on the line, if we're not already, will be, those of you who join us in naturopathic medical education and get your ND, will become an expert in CAM clinical practice. And the NCAM has the goal of gaining knowledge and experience in rigorous, collaborative, multidisciplinary research in your field of complementary and alternative medicine. And these opportunities are divided into three areas: those who hold the doctoral degree, those who are early and mid-career professionals, and those who are members of a population that are underrepresented in scientific research. Essentially, we have three types of opportunities for our graduates, and they're divided into what's called the K series. These are individual awards for career development. The F series, typically we think of that as the National Research Service Award, and then the T awards, which are training awards or training grants for institutions who are committed to train pre- and postdoctoral fellows. Essentially, for those naturopathic physicians, whether they be early graduates or those who have been in the profession for a while, they're typically looking at individual awards that are either the K series or the F series. The K23 are patient-oriented research career development awards. The K08 is a mentored clinical scientist development award. These two are very popular, and we have a number of folks in the naturopathic profession who have applied for and received these grants. The F series, the NRSA, that National Research Service Award, is typically a F32 postdoctoral fellow, and it's an individual National Research Service Award. Both of these individual awards, or all of these individual awards I'm referring to, are essentially, they essentially offer the fellow or the postdoc monies to be able to do training. So many folks who go through these, apply for these awards, are able to get their MPH or Masters in Public Health. They're able to go forward and begin to think through what their research question is and gain experience in a mentored capacity to do that research. And they're also, in many cases, able to add funding onto their award so that they can go and even get their PhD. We have a number of folks in the community who have been leaders in this area, and I will speak to that in just a moment. These programs are all eligible for loan repayment. Essentially, with loan repayment, it's a competitive process. And it's important to note that there are eligibility requirements related to citizenship, Qualified educational debt, you'll be very pleased to know that naturopathic medical education is a qualified educational debt, so you can get loan repayment for your ND degree. The research has to be domestic and nonprofit, and then it needs to be qualified research. There are a number of other elements to the loan repayment programs, including information online through the NIH as to how to write for a competitive loan repayment program application. The career opportunities through these various venues include being in private practice, and I think everyone interested in medicine generally begins with the desire to be in private practice and to help patients get better and to help them find healing and wholeness. Research certainly can be very much practice-based through the utilization of electronic health records and participation in practice-based research network. That's something that anyone in private practice can do, along with writing case studies and case reports on various interesting cases that have had an outcome that was unexpected or unusual. Career opportunities also include academic opportunities. We have a number of naturopathic physicians who are at major universities doing quite a bit in teaching and also in research. So research can be academic research at these centers. We have folks at University of Connecticut, University of Michigan, Columbia, and other large institutions. Research can also be in industry, so the natural supplement industry is always looking for people with expertise in complementary and alternative medicine to participate in designing studies and in conducting that research. And then there's also government opportunities, the intramural opportunities through the NIH, NCAM, and other centers within NIH. We recently, in the last couple of years, have a naturopathic physician who serves on NCAM as a program officer. It's the first time our profession has had a program officer at the NCAM. And it's actually quite an achievement for her and also for the profession. So that ends my presentation. I thank you for your attention, and I'll look forward to questions in a few minutes.
Thank you, Dr. Gerard. Great information. My next speaker is going to be Dr. Jeff Langland. Dr. Langland received his doctorate degree from Arizona State University in virology. Dr. Langland's area of interest is the complex cellular defenses against microorganisms. Dr. Langland became the first joint faculty member at SCNM, maintaining his position at the ASU Biodesign Institute and becoming the instructor for medical microbiology and research courses. So without further ado, here is Dr. Langland.
Welcome, everybody. So what I'd like to introduce now, kind of go on the same facet of what Dr. Gerard was talking about, but really introduce some of the individual products that products and programs we've been developing here at SCNM, what areas of research we are currently working on, what our plans are for the future, in terms of naturopathic medicine and where we can take it in terms of some specific examples. And so, like Dr. Gerard mentioned, a lot of what we're trying to do with research in naturopathic medicine is to really validate and improve upon the medicine we have here. And even though we have, hundreds or thousands of years of evidence behind treating patients with, botanical medicine or various other modalities, we can really bring it into today's world and try to improve upon it, validate a lot of the evidence behind these hundreds of years of evidence behind it, and really create what we're working on today as more of naturopathic medicine being evidence-based medicine. And so, we can really try to define, does naturopathic medicine really work? How does it work? What are the actual cellular targets? If we're dealing with that sort of aspects, if we're dealing with immune systems, what are we doing to the immune system? Anything we want to look at, let's do the research behind it. And if nothing else, trying to break down the barrier between naturopathic medicine and allopathic medicine, where there is a wall between the two, and to get better acceptance, we need to have the evidence behind it to define how it's actually working. So one thing we have at SCNM is strength behind our research, and a lot of it's done with some of the facilities we have here at the college, but we also have very, very strong collaborations with various research institutes nationwide. One of the main ones being Arizona State University, of which I'm a co-faculty member between SCNM and Arizona State University, and we have another faculty member, Dr. Robert Waters, who is a adjunct faculty over at ASU as well. And the convenience here is that we have Arizona State University about 2 miles from our campus here, and the facilities at the Biodesign Institute at ASU are phenomenal, where we have the ability to do more or less any sort of research we want to do in terms of DNA sequencing, any sort of analysis molecular biology-wise. We have animal facilities available. The limitations are unlimited in a sense. And so we have various students that will work here at SCNM doing basic research here. We also have a program where SCNM students can go over to ASU and be involved in research over there. Beyond that, we've also established other collaborations. We have a collaboration with the Center for Disease Control, and this is really a really phenomenal collaboration where we can actually have CDC working with us in terms of botanical products at this point in time and the effectiveness of them. We work with the University of Arizona, just south of us down in Tucson. We do a lot of characterization of botanicals with them. We also have other nationwide collaborations with like the University of Florida. SIGA Technologies is a company working with in terms of smallpox and our war on bioterrorism. And then Herbal Vitality is a company up here in Sedona that works with us in terms of our obtaining botanicals and quality control behind all our botanical products. So let me go through some of the projects we've been working on. We kind of go 2 different directions in terms of evidence-based medicine and naturopathic medicine, sort of thing. And the first area being in terms of just validating the modalities that we deal with here. Not so much as far as improving upon them, but really just further understanding them. Do they truly work? What is the mechanism behind how they're working? What are the cellular targets that may be involved? And that sort of idea behind that. And so one of our first projects we ever started working on was following 9/11. There was obviously an interest and a scare in the United States toward the war, toward bioterrorism and the release of bioterrorism agents. And one of the main ones being smallpox and the threat of smallpox possibly being released. For the most part, the United States no longer vaccinates individuals for smallpox, and so we're dealing with a situation here where we have a large population that's unvaccinated. We have a bioterrorism agent that could be released and have a high mortality rate if it was released. And so some of the ideas, let's not vaccinate anymore, but if a bioterrorism event did occur, how could we treat people in order to reduce the mortality rate? And so one of our projects dealt with looking through literature, and we came across a publication that was published in The Lancet in 1862. And so we're dealing with, remedies here that were over 100 years old. And, from the Lancet article in 1862, there were great claims of one particular herb that I'll go through here shortly, of having great effects on the Indian population in northern Canada that was used to treat smallpox at the time. And this was actually evaluated by a physician at an Army fort in that area, and his claims were that an old squaw going amongst the soldiers and treating with this botanical infusion was so successful as to cure every case. And this remedy, this was all claimed in the 1800s, and since then this remedy kind of just fell out of just basically disappeared and was completely forgotten about due to the vaccines and this sort of thing. Well, we decided to resurrect this and see if it actually could be used as a treatment for smallpox. And the herb we're using here is actually a carnivorous plant known as Sarsinia purpurea It's a pitcher plant, and grows along the eastern seaboard in the United States and up in Canada. And, if you look at the bottom there, this is just, I don't want to go too much into the science we've been doing here, but we've been able to take healthy cells that are shown left panel there, infect them with smallpox virus here, and you can see the cells round up and die. If we treat the same cells with an extract from this Sarcenia purpurea, you see the cells look perfectly normal. The herb is preventing the virus from replicating, and the cells are actually not damaged at all by the herb and grow and continue to grow perfectly healthy. And so we've been further able to take this herb here. We actually just recently published some material on this, and we've been able to break down and define how this herb works. We know that it works on, blocking virus once it gets into the cell. It actually blocks its RNA synthesis. And so this is what we're doing in terms of what we can do here at this college, where we can really put the proof and validation behind, these therapies that are hundreds or if not thousands of years old, and show their effectiveness. And so what we have today is something that we have proven that if there was a bioterrorism event and smallpox was released into the United States, we actually have an alternative therapy here that could be used and was used in the 1800s for smallpox. And we've actually validated through scientific evidence that it does actually inhibit the replication of smallpox. And this we've actually taken with CDC and worked with them, and CDC has validated all of our results. And so we have that recognition from even a place like the CDC. Other aspects of some of the other projects we're working on, one is that there's many botanicals that are known to work by stimulating the immune system. And yet that's a very broad term, and if you look through botanical medicine, many of them say it's an immune stimulant, and what does that mean exactly? We know today that we understand the immune system much better, that it's very difficult to just say something stimulating the immune system and understand how effective that might be toward treating infections, whether it be the common cold or a staph infection or anything like this. And so, and then that's really, really key for treatment. And so one aspect of what we're trying to do is take many of these immunostimulatory herbs and try to define this better in terms of, do they push the immune system more toward fighting off viruses? Do they push the immune system more toward fighting off bacteria or autoimmune disease or whatever aspect that we might be dealing with here? And so we're really trying to define well in terms of what's being stimulated within the immune system with these herbs. And so, this is more both laboratory data as well as stuff we can do with clinical studies, and we have a clinic here at SCNM that we can do this sort of clinical studies here. And so we can do things like, what we see here is, looking at white blood cell populations on 3 different patients here. No treatment, their white blood cells more or less don't change over a 24-hour period. But if we give somebody a botanical here, we can see that basically for all 3 patients, we see a significant increase in the white blood cell counts. We can further take that down, and if we look at individually what's happening in the patients, we can define specific interleukins, which are basically the signals within the immune system, and define what's happening in the whole body here. And like this herb here is an herb known as astragalus, and we can actually define based on what's happening with this herb that would be very, very useful, likely for the treatment of viral infections. But in some sense, this herb here probably wouldn't be very effective toward like bacterial infections, given what it's inducing here. And so this allows us to really break down the understanding of these herbs much, much better and define, 100 years ago when these, or 1,000 years ago, when these herbs were used in traditional Chinese medicine, we didn't know about the immune system that well, and now we can actually understand them much better in terms of what they actually are doing to the body. The other direction we're going toward a lot of our research is actually trying to improve on naturopathic therapies. Not only validating them, but can we actually take the research and make them better than what they were before. And one of our major products here is toward viral infections. And for example here, talking about developing botanical blends for the treatment of herpes. And what we've done basically is that if you look in botanical medicine, there are literally hundreds of herbs that have been defined and recommended for the treatment of herpes infections. What we've decided to do is, validate first off that these herbs do work toward herpes, but then can we design remedies, design a blend that would be even better in terms of fighting off the virus. And so, we can define things like what we see here. Going across here, we see these basic cells that are infected with the virus. We treat with a botanical going across here, and you see the botanical doesn't do much to the virus still replicates, and you see this whiteness going across here. That's significant of the virus just wiping out the cells in the dish here. If we have an effective botanical, you see the virus treatment here, as it increases the amount of botanical going across, we see this blackness appearing. That's basically indicative of the cells being present there. And so we can decide on herbs and say, yeah, we have non-effective botanicals, we have effective botanicals, and we can even rank these. What we basically created for herpes is a rubric where we can screen, at this point in time, we screen about 100 different botanicals for herpes, set up a rubric where we give each herb a score of 1 to 100, and we've created a blend today that is the top 6 herbs that we have activity toward. We've also defined the mechanism that we have some herbs that target the virus attachment to a cell, some targets like virus assembly within the cell. And so we have a blend that we can create today that's extremely effective at treating patients. And so what you see down here on the bottom is an example of one of our patients that we treated. Here you see a typical cold sore, that's fluid-filled vesicle of a person on day 0. More or less, they put on our botanical blend. Within 24 hours, all the swelling's gone down, the pain's gone away. We have actually an analgesic property of one of the herbs we work with, and basically it's all scabbed over within this 24-hour period here. And within 3 days, the skin's basically completely recovered. Now, this compared to conventional treatments like Abreva or acyclovir. Abreva's out there and is the conventional treatment right now for herpes. And a typical herpes cold sore, if left untreated, will typically last about 7 days. Abreva's out there, and clinical studies with Abreva says it reduces the symptoms of the virus by about a half a day to 1 day. So that's taking cold sore down from 7 days down to 6 days. Even prescription drugs, our clinical studies done say that reduces symptoms by a day and a half to 2 days. What we've done with our botanical blend here is typically with most patients, we see a reduction in symptoms by 3 to 4 days. So we're actually saying what we can create here with the research behind the botanical medicine that we do is that we can create something better than the current allopathic drugs out there, and can prove that efficaciously with the research that we do today. We've since gone on and we're using this sort of philosophy behind screening botanicals today, where we've created blends that work effectively toward herpes simplex 2, which causes genital herpes. We have a blend available for human papillomavirus. We're getting into the realm of cancer, dealing with squamous cell carcinoma and actinic keratosis, and also getting into the veterinary market, where we have had effective treatments toward animal cancers, as well as things like equine herpes virus, which is a huge problem in the horse industry. So this is where we can actually improve on the treatments we have currently. And the other aspect that we're doing here is that we can deal with standardization, which is a huge problem in the botanical and naturopathic market here, where when you go out and buy a botanical product, how do you know it's been standardized? And what we can do today is actually have that in the laboratory, where we can, our blends that we designed for and characterized by research with for herpes, we actually can say and create products that we can measure the antiviral units per milliliter and have that standardized between every batch of material we prepare for patients, from being today, 6 months from now, and so we have that consistency and standardization behind our products. One of the projects we're working on, the Staphylococcus and dealing with infections there, and Staphylococcus, MRSA being methicillin-resistant Staph aureus, has been in the news oftentimes over and over again with major infections. And here again, one of the major problems in the botanical naturopathic field is there's literally hundreds of herbs that are defined for use for Staphylococcus infections, and the problem comes down to which herbs would be the best, or would a blend be better. And so here again, we can do things like we see here with, this taking two of our herbs, eucalyptus or coleus, and looking at the growth of different bacteria, and this is Staphylococcus here. And so Staphylococcus, if we leave it, just let it grow, it'll grow like we see here. If we treat it with increasing concentrations of an herb here, we see, in this eucalyptus, we see reduction of the replication of the bacteria here. We take another herb, this is coleus here, and we do a similar effect here where we see, as we increase the amount of the herb, you see replication of the bacteria decreasing. And here again, so what we can do here is compare many, many different herbs, and some herbs we've tried against Staphylococcus don't have any effect whatsoever. And so we can have an understanding, which adds to the field of botanical medicine, we can have an understanding of which herbs are the best toward the treatment of staph infections, create blends that will improve on the effectiveness of these herbs, and work really effectively toward the treatment of patients. And so, that's a brief overview of some of our products and some of the areas that we've been dealing with and how we can use research in the naturopathic field. Some of the other areas we're going toward, one philosophy has always been in the botanical field is that botanicals are better than antibiotics like tetracycline or vancomycin, that sort of thing. And that's because the idea has been that bacteria can't develop resistance to botanical remedies. We're actually having students right now testing that sort of philosophy behind it, and we're taking different bacteria and treating them with botanicals day after day after day and seeing if they can develop resistance to these botanical remedies. And right now, our evidence is pointing toward the fact that, bacteria can easily develop resistance to conventional medicines like vancomycin or this sort of thing, but they have more difficulty for most botanicals to develop resistance. They still will develop resistance if we push them hard enough, but it's a step harder than the conventional medicine out there. I mentioned that we are going toward botanicals in the fight against cancer, and this is something we'll continue to develop. HIV, we're actually starting a new project here come the fall. We're going to, again, try to screen different botanicals for their effectiveness against HIV and for the treatment of AIDS. And we're going to try to create a blend that would be the most effective therapy we could have against HIV infection. And in the past, we've also gone to other directions like colloidal silver. Colloidal silver is a antibacterial, antimicrobial therapeutic that was used for centuries until we basically developed our standard antibiotics, and then kind of just fell out of the limelight and kind of forgotten about. We're trying to resurrect that and have characterized colloidal silver as being a very effective treatment for bacterial infections especially, and we're currently right now have a publication accepted for our studies on this. So last thing I want to mention here is, what is student involvement at SCNM in regards to research? And, this gives a little brief summary of some of the stuff we're working with. So again, we do some basic research at the campus here at SCNM. We have limited facilities, but we can do basic studies looking at bacterial replication, bacterial resistance, colloidal silver studies. And we have many, many students involved, typically around 20 to 40 students per quarter that are involved in research here at SCNM. For students that are really, truly dedicated to research and just love the research aspect of it, we do take a few students over to ASU every quarter. And this typically ranges from about 3 to 5 students at any one time. And here the students can get more involved in, truly more technical research. They can work with viruses. They can work with cancer cell lines. We can do PCR analysis, do immunological studies, just a step up from what students are doing at SCNM. And so we have 2 different levels that we can really get students involved there. As far as involvement, how to get involved, we do offer research courses that are basically introductory to let students know about the need of research and understand research in the naturopathic field. as well as courses that are basically allow students to get more hands-on involvement with the projects. And then we have a number of students that just are enjoying the research and just do it on a volunteer basis. As far as recognition, if you would get involved in research here at SCNM, it comes down to a number of different things. Obviously, if you are registered for courses, you can add it to your transcripts as well as having it on your curriculum vitae. But any research that students are involved in, whether it be at SCNM or ASU, all the research we try to do is designed to be novel and publishable. And so we've had a few publications come out of the campus here, and any students that are involved in that research do get their name on any publications. And last thing is obviously conference presentations. We have a number of students that present both at like naturopathic conferences as well as other national and international conferences related to the projects we're working on. And typically we have students, rather than myself or Dr. Waters or other faculty going there, we have students many times involved in going to the conferences and doing the presentations themselves on the work that they've been involved with. So recognition is very elaborate in terms of your involvement at SCNM in terms of the research. Will get recognized and have long-term goals associated with it. So I'll stop there and again open up for any questions, and I'll turn it back over to Jody now.
Thank you, Dr. Langland. Again, great information. I am going to open up the floor for a couple questions. I do have a couple questions that came through while both speakers were talking, so we'll get those answered for you. And also there was a couple questions that were submitted via our website. So, but do feel free to send me an email. You can reach me at j.durham@scnm.edu. So at this time, I'd like to open up the questions that you have regarding our research here at SCNM. My first question I have probably may go to Dr. Langland. Do students need experience to get involved in research activities, or can they start right away after they start the program?
We have students involved at all different levels. Probably the majority of students that are involved in research here at SCNM typically have no experience whatsoever. So we don't turn anybody away. We work with students one-on-one to get them the experience they need to feel comfortable in the research we're doing. We work together with, I'll work together with students individually when they're working on projects. And we also try not to let students have to do things on their own. We'll put students together as a team where they can be together with experienced as well as non-experienced other students, and so have that comfort zone where they don't need the experience and can gain it and work with the projects until they are more comfortable with it.
Great. My next question comes from Amber. Does an ND have to team up with an MD in order to combine allopathic medicine with natural medicine when going into research?
Dr. Gerard, are you more interested in that one?
I'll take that one, thank you. Amber, when it comes to doing research, typically when we are doing a trial in something we would consider to be complementary and alternative medicine, the team that is designing the research study seeks folks who have experience in that field. And in that case, as a naturopathic physician, you would probably be working more with PhDs and MPHs, Masters in Public Health. When it comes to doing a clinical trial on a pharmaceutical medicine, often the naturopathic perspective is not sought. So you may be working with integrative teams when it comes to doing research on complementary and alternative medicine, but not so much within allopathic medicine.
Great. My next question is from Michael. Michael asks, typically are academic positions taken on after a time of being in ND practice, or do folks go right into teaching from the ND program?
I can take that one. Typically, before coming into an academic appointment, a naturopathic physician would be in practice and gain experience before coming and teaching those who are in the program. In fact, our accreditor, the Council on Naturopathic Medical Education, requires our faculty who are naturopathic physicians to have a certain number of years in practice prior to teaching in the clinical setting. We follow, meet or exceed those guidelines. And generally my advice to a young physician is to go out and get some experience and then come back to us. That experience could be in practice. That experience could also be one of the fellowships that I was referring to in research, and then coming back to the college to teach either in the clinical setting or in the research department. Good question.
Great, great. This question I do have for Dr. Langland. It's from Trina. Trina asks, can an ND student propose a research project on his or her own that may not be a current area of study at SCNM?
The answer to that, Trina, is definitely yes. It has to fit within the realm of what we have the resources for in terms of doing the projects. So that's basically the only limitation. But the good example of that one is our Botanical resistance project. That was actually something that was mentioned by one of our students based on discussions that that student had with going through his coursework, and it was suggested, well, how about we try to see if bacteria can develop resistance to botanical remedies. And so, yes, we're definitely welcome to that sort of aspect behind it. And again, it's limited in terms of what we have available, and that'd be the only deciding factor there.
Perfect. Dr. Langland, this was probably another one for you. Elena asked, what botanicals were in the blend that the most effective in treatment of oral herpes? That's getting very specific, and some of it I can't tell you because we actually are working with some of that work there was funded by a company that we work with, and so some of that we have to keep proprietary. But when we did do our screening of all the 100 or so herbs that we worked with, we actually did it double-blinded, where we just set every herb a code and set up that rubric where we could tell which herbs were best and which ones were worse. And to validate our research quite a bit, some of our best herbs that we ended up with are ones that are conventionally used in the treatment of herpes more readily than other ones. And so 2 of the herbs that I can tell you, it's a blend of 6 herbs right now. 2 of the herbs that are in there are some of the most common ones used for treatment of herpes, which are Melissa officinalis and Glycyrrhiza, which is licorice. Great, great.
Thank you.
My next question comes from Christopher. Christopher asked, I have 2 undergrad research projects that I have worked on. Will that put me kind of in front of the line, per se?
Oh, I'll take that one. It's not really in a line, per se, because here again, what we typically, so for most students coming in, usually they're here toward the end of their first year before they start on research projects. It just helps to get students settled in and into their coursework. The first year with the integrated curriculum is a difficult curriculum to follow, and so I don't like to bring students into research right away. Kind of get into the program here first off, and then typically around quarter 3, students start to get involved in research. And here again, I like students first off to get involved with research at SCNM. It may be more of a basic project and this sort of thing, but it's not really that I don't want to push students away that don't have the experience or necessarily rank them in terms of this one needs coming first or second. Really, it's an open door policy, and for the most part, I don't turn students away from doing research at SCNM. Now, when it comes down to doing research at ASU, we do have a little bit more of a guidelines around that and a selection process where it takes a lot more time commitment for students to be over there, and as well as having more research experience. And so this is where your research experience may help you in terms of getting over to ASU and being involved in the research over there. Thank you.
Great, great. This next question goes to Dr. Gerard from Christopher. Christopher asks, since there are opportunities to pay back loans by getting involved in research, do I need to worry about having a job if I do in fact come to school for my ND with these emerging opportunities? And his next question says, how many of your students are you seeing going into research right away?
All right, Christopher, I'll try to keep track of both parts of the question. The first part, I would say our program is strenuous and comprehensive enough that we really don't recommend that you take a job while you're in school full-time. It's just a lot to manage and still be successful. There are some students who do it, and if you come here for a student for a day experience, you'll be able to speak to students who have done this both ways, and hear their opinions on it. In regards to the loan repayment programs, I want to stress that a student is only eligible for the loan repayment program should they be awarded one of the fellowships or career development awards I mentioned through one of the NIH centers. And so that is something that would happen after you complete your ND. The students that I'm aware of who have done this have been working with the NIH and their mentors to complete their application in their last year of med school, so that within their first year out, they're able to slide right into a fellowship or a career development award. Those awards typically are 2 to 5 years in duration, and as I mentioned, they allow you to go on for additional training. Usually folks are getting their master's in public health and or a PhD and conducting research at the same time. So it's a really great way to be able to explore research. And honestly, people don't go into those awards without having a very strong commitment to research as a professional choice. So there are other loan repayment programs that our students and graduates newly are now eligible for that have to do, or they both have to do with clinical practice in underserved areas. If you have more questions about loan repayment, you can contact one of our admissions reps and we'll be able to field those questions for you. And now I have promptly forgotten the second part of your question. So Jody, can you remind me?
It's as far as if the loan repayment, and then if there were, how soon do students go into research after starting the program? Do they start right away, or do they take a couple quarters before they do that?
So I guess I did answer that. Typically with the awards that I'm referring to, students will be applying at the end of their program. And there are other opportunities to do research, such as Dr. Langland has discussed, and those aren't dependent upon these career development awards, but they are dependent upon external funding. And so the funding is always the tricky part. I know Dr. Langland knows a lot about that and might be able to speak to that further.
Yeah, I mean, the funding is one of our major critical issues here, and that regards to the selection of projects as well, because we have to have funding that coincides with the projects we're working on. But, you know, typically, like I said before, most students get involved with research here during their coursework, typically around quarter 3 or so, and they're welcome to be involved during their entire career here. And then once they graduate, we obviously welcome and recommend students staying affiliated with SCNM if they want to continue to be involved in research. I think that's one of the best ways to have that collaboration set up, that, you know, we do a lot of clinical studies with NDs that have graduated from SCNM, where we have like our herpes product, and we contact them and say, you know, do you work with patients with these sorts of conditions, and will you work with us in terms of doing clinical studies with us and that sort of thing. And then, of course, we're also always welcome that if students, once they do graduate and have clinics set up, if they want to contact us with projects they have on their own, we're welcome to discuss them and maybe submit grant proposals and this sort of thing based on projects we may do as a collaborative effort.
Great, Dr. Lingland. I'm going to take one more question. Actually, this is from Nada. Nada asks, I live in Houston and married. After studying at SCNM for 4 years, is there any job opportunities in like a state of Texas that is not a licensed state?
Jody, I'll do my best to field that. Nada, Texas at this point is an unlicensed state, and so the job opportunities there would be very different as compared to in a licensed state. I know that we have a number of graduates who are in practice in Texas in various areas of the state, and if memory serves, there's a hospital with an integrative model, but I don't know if they have NDs on staff or not. My memory is that's in Dallas. I might be mistaken on the city. One of the services that we offer here at the college is the Career Services Specialist, Joanna Hagan. And one of the things that she does with students as they're first in the program, throughout the entire program, and even as alumni, she helps them get placed with different practices or with an industry or that type of thing, helps them write their CVs or create business plans and that type of thing. So she would be a great resource in regards to keeping track of what opportunities are in the state of Texas or in the surrounding states.
Great. Thank you, Dr. Gerard. At this time, what I would like to do is I would like to answer any questions you may have regarding admissions. Up on my screen, you'll see the requirements for the admissions process, and that's doing your application through NDCAS, which is a centralized application service that we use. Letters of recommendation are part of the admissions process, as well as essays. All of this is done through the NDCAS website. Transcripts are obtained from all the colleges, and as of course you have to have a 4-year bachelor's degree. The prerequisite coursework that you would need to complete, as well as the bachelor's degree, are here on my screen, and those include 12 semester credits of biology with labs, 8 semester credits of chemistry with labs, 4 semester credits of organic chemistry with labs. Keep in mind those sciences have to be at a science major level, as well as all have labs with them. And then your gen ed classes that you probably fulfilled while you were working on your bachelor's degree is your 6 semester credits of humanities, 6 semester credits of psychology, and 6 semester credits of English. I do recommend that if you have any questions regarding the admissions process, contact your advisor. We are still taking applications for our fall intake, which starts in October, as well as our winter, which starts in January. So we are still accepting applications for those 2 dates, as well as interviewing. I do want to share with you, I do have another webinar coming up July 24th. Unfortunately, it has slipped my mind what the topic is. So do go to our website. I think it's regarding field observation. Do go to our website to see the time for that webinar, as well as the topic, and that will give you who's speaking as well. At this time, on behalf of SCNM, I would like to thank each of you for attending this webinar.